Hey, this is Becky and we're here at VCSG and we're going to do a radiation safety video. So we're here at radiology. Outside we've got all the dosimetry badges. They're in alphabetical order. So step one is to find your dosimetry badge. Get ready to place it on your thyroid shield. As you come into radiology, you will find your gowns, your protective equipment, and your gloves. So select a thyroid shield and a gown. Place the gown on your body. Most of them are Velcro, some of them latch. Just make sure it's nice and secure and not going to fall off. Place your thyroid shield up close to your neck. Make sure you've got your badge. Clip it onto the bottom of your thyroid shield so it's picking up information from your thyroid up. It's trying to detect whether or not you get too much radiation exposure over time to important organs in your neck or your face. So one of the best ways that we can prevent scatter or excess radiation is to collimate for your patient size. So if you have a small dog and you're trying to get a quick x-ray, don't leave it big enough for a 50-pound dog if you're only taking a 25-pound dog's chest. So just really take it down to the size that you need it to be. Make sure you're collimating to the size of the body organ, body area that you're wanting. Over here on the shelf, we have gloves, right and left leaded gloves. So they're just big and awkward. They don't give you great control, but if you have a patient that's well behaved, you can certainly hold on to these legs and make sure that they are out of the picture. And especially if you're trying to do a jaw or something like that, it'll allow you a little more control. There are some techniques with doing a leash or a little piece of tape, some gauze, and we can talk about that in a later video, but you want to make sure that you are getting your fingers and any part of your body as far away from the beam of light as possible so you're not having excess scatter radiation into yourself. So wear your gown, wear your thyroid shield, make sure you're running your dosimetry badge, use the leaded gloves when needed. In a sedated patient, you also have the benefit, the one who has a decent amount of analgesic on board, you can also use something like a sandbag. If you have pulled their legs back and you just need these legs to stay in a caudal position, you can take, if the head is pointed that way, so I'm pulling towards the tail, you can take and weigh down the legs, and that also removes you further from the image. The only thing to worry or take precaution with on this is make sure that you're not putting it across in some way that you're weighing down the chest, because you don't want to inhibit its ability or restrict its breathing ability. But otherwise, these are great to use to keep your fingers out of the image. And that's how we guarantee our safety in radiology at VCSG. Thank you.